Bronchiectasis is a respiratory disease. Look at this picture, shows that normal bronchus and bronchiectasis bronchus. Look at this. Chest X-ray findings and CT findings. Look at this. Detail going on. Introduction. Bronchiectasis is a chronic lung condition characterized by the abnormal, irreversible widening and thickening of the bronchial tubes. This dilatation results in impaired clearance of mucus, which make the airways prone to infection and inflammation. The condition often leads to recurrent respiratory infections, persistent cough, and sputum production, greatly impacting quality of life. Definition. Bronchiectasis is defined as the permanent enlargement of parts of the airways in the lungs due to recurrent infections or inflammation. The abnormal widening of the bronchi and bronchioles disturbs the normal clearing of mucus, leading to mucus buildup and increased susceptibility to infections. Types. 1. Cylindrical bronchiectasis. Uniform cylindrical widening of the bronchi. 2. Varicose bronchiectasis. Irregular and bedded appearance of the bronchi with alternating areas of narrowing and dilatation. 3. Cystic bronchiectasis. Severe form characterized by scare-like dilatation of the bronchi. Causes. 1. Infections. Chronic severe respiratory infections, example tuberculosis, pertussis and pneumonia. 2. Immune deficiencies. Primary immunodeficiency disorders like common variable immunodeficiency CVID. 3. Genetic disorders. Conditions such as cystic fibrosis or primary ciliary dyskinesia. 4. Obstructions. Blockages in the airways due to foreign bodies, tumors or enlarged lymph nodes. 5. Autoimmune diseases. Conditions like rheumatoid arthritis and inflammatory bowel disease. 6. Chronic aspiration, repeated aspiration due to gastroesophageal reflux disease or swelling disorders. Risk factors: 1. History of recurrent lung infections. 2. Cystic fibrosis or other genetic conditions affecting the lungs. 3. Smoking and exposure to environmental pollutions. 4. Chronic respiratory condition like COPD. 5. Weak immune system or immunodeficiency. Complications: 1. Recurrent lung infections. 2. Respiratory failure. 3. Hemoptysis. 4. Cor pulmonale. 5. Reduced quality of life due to chronic symptoms. Pathophysiology: in bronchiectasis, the infection or other causes lead to chronic inflammation which damage the bronchial walls. This damage weakens the walls, causing them to become dilated and lose their elasticity. The impaired mucus clearance result in mucus accumulation, creating an environment that fosters bacterial growth and chronic infection, leading to vicious cycle of infection and inflammation. The pathophysiology of bronchiectasis involves a series of steps that lead to the abnormal dilatation and damage of the bronchial walls, resulting in chronic respiratory symptoms. Here is step by step breakdown. 1. Initial triggers: infection, inflammation or obstruction. 2. Inflammation of bronchial walls. 3. Damage to bronchial wall structure. 4. Abnormal dilatation of bronchi, bronchiectasis formation. 5. Impaired mucociliary clearance. 6. Chronic mucus accumulation and bacterial colonization. 7. Cycle of inflammation, tissue damage and airway remodeling. 8. Hypoxia and potential systemic effects. As the disease progresses, the bronchiectasis affects areas reduce in function, limiting efficient gas exchange. This can lead to hypoxia, low blood oxygen levels, and in severe cases contribute to right side heart failure or core pulmonally due to increased pressure in the pulmonary arteries. This cycle of infection and inflammation and airway damage perpetuates, making bronchiectasis a chronic, progressive disease that worsens over time without proper management. Signs and symptoms: 1. Persistent cough with large amounts of sputum. 2. Recurrent respiratory infections. 3. Shortness of breath. 4. Wheezing. 5. Chest pain. 6. Fatigue and weight loss. 7. Hemoptysis in severe cases. Diagnosis: 1. Chest X-ray may show enlarged airways and signs of chronic infection. 2. High resolution CT scan, the gold standard for visualizing airway dilatation. 3. Sputum culture identifies bacteria in the sputum and helps guide antibiotic therapy. 4. Pulmonary functions test measures lung function and assesses the severity of airflow limitation. 5. Bronchoscopy used to inspect airways and especially in the case of hemoptysis or foreign body obstruction. Nursing diagnosis: 1. Ineffective airway clearance resulted to mucus accumulation. 2. Impaired gas exchange related to mucus plugging and bronchial ball thickening. 3. Risk for infection related to mucus retention. 4. Activity intolerance related to dyspnea and fatigue. Management: first, medical management. 1. Antibiotic therapy to treat infections and reduced bacterial load. 2. Bronchodilators to help open airways and relieve wheezing and shortness of breath. 3. Mucolytic agents helps thin mucus for easily expectoration. 4. Chest physiotherapy techniques like post-oral drainage and chest precaution to help clear mucus. 6. Oxygen therapy for patients with severe hypoxemia. In nursing management, 1. Airway clearance techniques. Teach patients breathing exercise like coughing and techniques for clearing mucus. 2. Positioning. Encourage the use of post-oral drainage positions to aid mucus clearance. 3. Monitor respiratory status, assess respiratory rate, breath sounds, and oxygen saturation frequently. 4. Hydration. Encourage adequate fluid intake to help thin secretions. 5. Patient education. Instruct on infection prevention, correct use of medications, and recognition of infection symptoms. 6. Emotional support. Help patients cope with the chronic nature of the disease and its impact on daily activities. Treatment. Pharmacological treatment. 1. Antibiotics. Specific antibiotics based on sputum culture and sensitivity. 2. Bronchodilators and inhaled corticosteroids. Reduce inflammation and improve airflow. 3. Expectorants and mucolytics aid in mucus clearance. Surgical treatment. 1. Lung resection, removal of severely damaged lung section in localized bronchiectasis. 2. Lung transplantation, considered in end stage disease when all other treatments have failed. 3. Physical therapy and pulmonary rehabilitation improves physical endurance and breathing efficiency. Psychosocial medicine. 1. Emotional impact. Patients may experience frustration, anxiety, or depression due to recurrent symptoms and limitations. 2. Support groups encouraged for emotional support and coping strategies. 3. Lifestyle adjustments. Managing chronic symptoms can be overwhelming. So, a multidisciplinary team approach is helpful. Prevention. 1. Vaccination. Ensure immunization against respiratory infections. 2. Prompt treatment of respiratory infections. Early antibiotic therapy can help prevent the onset of chronic infection. 3. Avoid smoking and pollutants. Smoking cessation and avoidance of respiratory irritants are crucial. 4. Management of underlying conditions. Treat chronic conditions like GERD or autoimmune disorders to minimize the risk. In conclusion, bronchiectasis is a chronic respiratory condition that requires lifelong management to prevent complications and improve quality of life. A combination of pharmacological, supportive, and preventive measures, along with patient education, is essential in managing this condition effectively. Early diagnosis, appropriate interventions, and a comprehensive treatment plan and care plan are crucial to achieving the best possible outcomes for patients with bronchiectasis. Thank you. Have a nice day.